Utilization-Focused Evaluation by Rashonda Thomas, Naiz Uloa, and Pamela S. Table of Contents. Model's purpose, design, 5-step framework, philosophical perspective, history of development, major developers, uses of model, implementation techniques, steps for implementation. Model's purpose. Evaluation is done for and with specific and intended primary users. It utilizes stakeholder input. Purpose is to make improvement in a program or help make decisions about future programs. Facilitates decision-making amongst the people who will use the findings. Can be used for different types of evaluation, such as formative or summative. Design. There are two essential elements. The primary intended users of the evaluation must be clearly identified and engaged in the process. Evaluators must ensure that intended users of the evaluation guide all the decisions that are made. The framework could be used in a variety of ways, depending on the situation. Patton's original framework consisted of a 5-step process. However, there are now 12 and 17-step frameworks. 5-step framework. 1. Identify primary intended users. 2. Gain commitment to UFE and focus on the evaluation. 3. Decide on evaluation options. 4. Analyze and interpret findings and research conclusions. 5. Disseminate evaluation findings. Philosophical perspective. An evaluation should be judged on its usefulness to its intended users. It should be planned and concluded in ways that enhance the likely utilization of both the findings and of the process itself in order to form decisions and improve performance. History of development. The Utilization-Focused Evaluation, UFE, was born from a mid-1970s study in which Michael Patton interviewed evaluators and users of 20 federal health evaluations to learn what factors contributed to the use of the evaluation. From a literature review, which encompassed methodological issues, political factors, and nature of the findings, positive, negative, surprising, Patton and his colleagues identified 11 potential factors that contributed to the use of the evaluation. However, when asked about the one factor that most influenced use, 2 factors were identified: political considerations and the involvement of a person or group that cared about the evaluation and its results. This is what Patton calls the personal factor. Patton's UFE emerged from these findings. However, UFE takes the personal factor a step further. In addition to having personal engagement in the evaluation, UFE's principles include helping the evaluator to identify these individuals and working closely with them to achieve use. Major developer. Dr. Michael Quinn Patton is an independent organizational development and program evaluation consultant and the former president of the American Evaluation Association. Dr. Patton has 40 years of experience conducting evaluations, training evaluators, and writing about ways to make evaluation useful. Patton has written several books on the art and science of program evaluation, including Utilization-Focused Evaluation, of which he is the founder. Dr. Patton has worked relatively in the field of evaluation since its inception. Patton has presented his utilization-focused evaluation at the international, national, state, and local levels, and has applied this evaluation model to a broad range of areas, including anti-poverty programs, leadership development, human services, public health, medical education, employment training, criminal justice, diversity initiatives, and community development, just to name a few. Uses of the model. There is a focus on the evaluator's role in providing information to improve the quality of decisions made by stakeholders and organizations. Implementation techniques. Interaction between evaluator and users is important in securing personal factors. Evaluators should develop a personal relationship with users to meet their needs and sustain their interest in the evaluation. Evaluation can be used as a participatory approach due to a focus on working with key stakeholders or groups. Steps for implementation. 1. Identify intended user individuals by A. Interest in study, B. Power in organization or program. 2. Involve stakeholders in conduct of study. A. Identify questions of interest. B. How will the information be used? C. Involve them in design and data collection stages. 3. Interpret results. A. Make decisions about judgments, recommendations, and dissemination.